I know that there have been a few stories coming out of the UK where, young kids have either super rare or very degenerative diseases that are deadly. And because the UK isn't pursuing these super experimental treatments, they can't get treated in the UK. And also the UK doesn't want to fund those things. But also the UK has been denying petitions for these families to take their kids overseas to seek treatment. Why do you think that is? I don't understand.
I think it's just this general idea of the NHS being the best source of authority around healthcare. And, well, the issue is people don't like to think of it as rationing, but it's literally rationing. Like, they have to prioritise certain things. And when you criticise the NHS, it's not the doctors or nurses that you're criticising. And it's not, like, politicians in general. Like, I think politicians are incompetent, but I don't think they're trying to kill us. Maybe, but...
Some of them might be, but we don't know that for sure.
But I think with these things was extremely difficult moral dilemmas and of where funding should go towards, like you said, with the euthanasia part, but also with, like, trans stuff. Like, when the state determines, like, political issues, like, there is a political aspect in medical care. One thing that the UK, the NHS recently disbanded to a local level, but it was a massive issue, was the Tavistock Clinic, which is a child transgender clinic, where they were rushing because of the waiting list, because of the backlog of everyone thinking that they're trans all of a sudden. There were so many young people wanting to go on, like, puberty blockers, and that was just fast-tracked. There's this really good book called Time to Think, where it basically, there's this idea that puberty blockers give young people time to think about their gender.
Yeah, it's like pressing pause on puberty, right?
Which is really not true.
No bad outcomes.
Which is really not true because it just, like, it confirms it and it makes them double down on it. When in reality, I think even if you identify as trans, I don't think it's something... You don't want people to go through surgery when they don't have to. So if there's a possibility of them not having to go through that and maybe just go through, normal puberty, that should be a preferred option. But they're trying to get rid of that. And also, the Tavistock Clinic and the NHS and the government in general are being pressured by this group called Mermaids, which is a child transgender group. It was also partnered with Starbucks as well. Yeah. And
what?
Yeah. And they're pressuring doctors, for example, to not question a child's gender. Like, if you say, are you sure you think you're the opposite gender, that would be illegal under what they want. So that's another issue of a state-run healthcare system.
Because it's abusive to ask questions, right? That's not affirming
It's conversion
enough.
therapy, they say.
Oh my gosh. Yeah, that's a huge issue. And I wonder, so going back to the NHS needing to be this moral authority and needing to constantly assert that in order to get the buy-in of the people, like they did in these cases where it wasn't even just that the NHS wouldn't operate on these kids, they wouldn't even let them leave the country. Like, they forbid it. So they essentially blocked parents from being able to give their children a second shot, I wonder if that leaves room for the NHS to then start making decisions for parents about their children's transition. So, like, if a child starts talking at school about how they want to transition and be called different pronouns and a different name, and now they want to go on puberty blockers, like, it does trouble me if the NHS has positioned themselves as the ultimate authority. It does worry me that they would start, like, going around parents' wishes. They're
already doing that. Rishi Sunak tried to... One of the good things he did, and he failed to do it, he tried to make sure that when a child says that they're transgender and reports it to a school authority, he wanted to make sure that they report it to the parents, which I think a decision like that should be reported to the parents. And under any other safeguarding thing, like if a child goes up to the teacher and says they want to kill themselves, for example,
Yes.
that would be, told to the parents. So why is this any different?
Yeah.
But he couldn't put that into action because of the UK Equality Act, which puts transitioning under a protected characteristic. So that law couldn't be implemented. And the same thing with mermaids, they actually receive funding by the government. They receive grants by the government. They've been...
Why are they receiving grants by the government when it's so clearly a political
Because it's
group?
like a charity. There's like this massive charity complex in the UK. Where,
Same here. But
yeah. Where it's just like these activists are going against like what the people generally want to push like this radical progressive agenda.
That's horrifying. This is the problem with taxation. Not only are they stealing your dollars, but they're sending it to organizations that are completely misaligned with your interests.